For the agent that must be in the know, Medicare Industry Insider discusses critical insight, noteworthy trends, and upcoming issues in the Medicare market.
Deciphering and debating the legislation, regulation, and what's happening in the market. I'm Jalen Jackson.
And I'm Rachel Brameyer, and we're going to talk shop, dive deep into these complex topics, and make them understandable and actionable.
If you've ever wondered where the world of Medicare is going and how to prepare for the future, Medicare Industry Insider is the resource you've been looking for.
Welcome to another episode of Medicare Industry Insider, and I'm Rachel Brameyer.
And I'm Jalen Jackson.
And today we're going to go into chronic conditions. There are so many different directions we can go with chronic conditions. I think the big things that we wanted to take away from this episode is the different election periods, the different resources that are available, the networking opportunity, and just overall how big of an impact knowing about chronic conditions can do to help your business.
Absolutely. And I think really to start understanding the outsized impact that chronic conditions have on the overall market of not just Medicare, but the health insurance sphere as a whole. Right now, the American Hospital Association estimates that over 133 million Americans, which is almost half the population, suffer from at least one chronic illness. And if you look at other data, you'll see that when you get to the demographic of Medicare age individuals, around 66% or almost 2/3 have more than one chronic condition, sometimes as many as 3 or more. And they classify those as 21 specific conditions as codified by the CDC, which includes common things that you may think of like diabetes and heart failure, various other things like high cholesterol and blood pressure, but also things like alcohol abuse, schizophrenia and other psychiatric disorders, depression, cancer, atrial fibrillation, even asthma, all count as chronic conditions.
So as an agent looking at these 21 chronic cases, if you could create resources and kind of know the people in your community or networking partners that help with things like asthma or AFib or cancer, that is game changer because like we said, about 2/3 of those people that you're servicing have one or more of these chronic condition cases as defined by the CDC. The most common ones are high blood pressure, which you probably already know that by all the drug lists you've read. In fact, 58% of the chronic condition cases are high blood pressure. High cholesterol, also a duh one because you probably ran so many high cholesterol. Heart disease, arthritis, and then diabetes. So that would be the top 1, 2, 3, 4, 5, 6 conditions that makes up the majority of beneficiary chronic condition cases.
Absolutely. Definitely the most common amongst those. And unfortunately, due to a lot of fairly preventable, especially nowadays, reasons, the CDC lists several, kind of a short list of high-risk behaviors that lead to many of these chronic conditions, including, and again, a lot of these are kind of falling out of favor, but when you're talking about the Medicare age population, and even those underage on Medicare, things like tobacco use and secondhand smoke, poor nutrition, including specifically diets low in fruits and vegetables and high in sodium and saturated fats, physical inactivity. You've probably heard if you've been following trends in the workplace, sitting is the new smoking. Physical inactivity does have a huge impact on your health. And then excessive alcohol use, which as insurance agents, we don't know anyone who's ever drank to excess, but I hear it can hurt you.
Which is actually good. Well, not that's funny, but I was just thinking about my shopping list on Amazon. I keep getting advertised for the under the desk treadmill. So I think, you just said sitting is a new smoking. I think it's figured out I sit for a living. So, but it is interesting. I want to share a really quick story too, just poor nutrition because we talk a lot about all the extra things that carriers do to try and help prevent a lot of that.
Sure.
We heard a story about a Medicare Advantage carrier who sent a skilled nurse out because they do those in-home nurse visits as part of their benefits. And they couldn't figure out why this person was on all these medications, who was having lots of trouble. The doctors couldn't figure it out. Nothing was kind of fixing it. And then the skilled nurse that came out to do the in-home visit was taking a look, and on the counter, this particular person had Hansa soup cans. And so the nurse goes, is this your main diet? And they said yes. And those obviously have a ton of sodium in them. So they're thinking they were eating healthy. So that actually fixed a lot of their nutrition, and they were able to get off some of those medications that they were on. So it's little things like that that sometimes get neglected a little bit, of just the diet in general affecting.
Yeah.
Well,
and I would say just, don't underestimate the physical limitations of preparing food and how that can impact your client's health and well-being. It could be that something as simple as having difficulty opening jars can actually impact drastically someone's nutrition if they have trouble managing certain types of packaging. Even, I bet those soup cans were all probably pop tops, rather than having to work a can opener. Things like that can actually impact your client's ability to care for themselves. And the other big thing I would take away from that story, Rachel, is a lot of agents are, I would say, skeptical of interactions between the beneficiary and the carrier, and don't always like it when the carrier calls my clients and things like that. But there are a lot of really important reasons to facilitate that, because it can get your client access to better coordinated care, access to benefits that they may not otherwise qualify for. We're going to talk a little bit later about special supplemental benefits for the chronically ill, or SSBCI, many of which have to be qualified for based on sometimes something as simple as chart review. Other times it does require that in-person interview to establish their qualifications. So very important to help facilitate at least some beneficiary interaction with the carrier, so they're actually getting the most out of the plan you signed them up for.
I would say, in addition to that, like looking through these top 4, which is tobacco use, poor nutrition, physical inactivity, and excessive alcohol use, looking through that as an agent, thinking through like, okay, if those are why people, a lot of the reasons why people have chronic conditions, maybe working really closely with like Meals on Wheels or different local, we actually have a couple local places in Columbia, Missouri that are literally just prepackaged, microwavable, really good food that maybe you could even like get samples of, or like do something where, it's more recognition for the company, but also to your clients to get them better nutrition, physical inactivity. Like, who knows? There's lots of different directions you could go. There's like in-home physical therapists. There's lots of like gyms that have a lot of the benefits that you put them on with Medicare Advantage, have gym memberships, like getting them to utilize some of that stuff.
And I think this is
hugely helpful.
Absolutely. Sorry.
No, you're good.
I think this is, we stress this time and time again. And like we beat this horse to death, but we always stress in a lot of these episodes how important it is to be a well-known and well-regarded resource in your community and to have a broad array of connections. There are a lot of, maybe your clients aren't the most tech savvy, or maybe don't have access currently to internet or things like that, but there's a lot of federally funded and state funded programs out there right now to get folks internet access, get folks even devices to use the internet at no cost. And even if someone can't physically go to the gym to use the gym membership on their plan, or maybe they're on a med sup and they don't have that free gym membership, there are still a ton of things that they can do at home that you can easily facilitate, helping, maybe they're already at least a little bit tech savvy. You can help them bookmark the Silver Sneakers YouTube channel, or help them find a good chair yoga, channel or something like that to follow. There are a lot of things that even can be done in the home that are low impact, high value exercises that can drastically improve not just their physical state, but as we know, exercise and physical activity is also an incredible mood booster as well. So even simple things like that can really help your clients in some ways.
I'm even thinking about fun marketing ideas. Now you could do like a fun little like chair yoga class that you invite your clients to. You can post those things on your social media so that people are more likely encouraging your clients to follow it. Maybe you post a weekly workout video for them. There's so many fun things that you can do or even like the poor nutrition, like maybe it's easy meals that are healthy, maybe connecting with like a nutritionist or something like that. There's so many directions that you could go, knowing that those are the top 4.
Yep, absolutely.
Let's switch gears. Let's talk drug industry.
what better way to go? I think, okay, so I think that this is one of those fun things where we have all these incredible chronic conditions, some of which have clear and easy solutions to an extent. We talked a little bit about, mitigating some of the risk factors of these chronic conditions, but unfortunately, a lot of them are not necessarily, I guess you would say, curable, but they are manageable. And that tends to be the way the pharmaceutical industry goes when it comes to chronic conditions, is management. And until very recently, we're actually seeing a change in this trend, but let's go with diabetes as a key indicator of how things have been handled in the past. We have a lot of tools out there for managing diabetes, insulin, non-insulin diabetic medications, everything from your old school metformin to your new GLP-1 inhibitors. And a lot of these traditionally have focused on managing insulin levels, managing things like that. But now we're starting to see both evidence and usage of better tools for weight loss, which can drastically improve outcomes for diabetic individuals. So looking more towards causative solutions rather than just maintenance of a particular chronic condition. Another great example this past year, the FDA approved a new drug for treating hemophilia, and it was actually fascinating to follow that through the process, as it was the most expensive drug on a per-dose basis ever approved by the FDA, approved at $3.5 million per dose. Now, interestingly enough, it's a pretty good deal because this is a one-time administration of this drug that is a gene therapy, and compared to the current costs of blood transfusions, protein drips, all the current most effective treatments for hemophilia are expected to cost someone around $22 million over the course of their lifespan. Now, of course, not necessarily out of pocket costs to insurance and things like that, but at $3.5 million, it's actually a deal in the eyes of the insurance companies. So that's how they ended up pricing that novel treatment. But tons of examples like this where we either create more problems by the treatments we offer folks, or just have to continue to manage and manage and manage.
Yeah, I think looking at the drug industry in general for chronic conditions, we're seeing a lot of drugs. Obviously, we talked about the top, 21 chronic conditions. So that's where the drug companies are focusing on too, because that's the big money makers. We're looking at over half the population utilizing them. I was just taking a look at heart medications in general, and we're looking at over 30 there's different ways to treat heart complications. You've probably heard like ACE inhibitors, because I've heard of that before. There's cholesterol lowering medications, all sorts of different directions you can go to help treat heart issues, meaning high blood pressure, cholesterol, things like that.
Sure.
Over 30 drugs that are just specific on that industry. So you can see we're looking at, opposed to like if you focused on maybe like the weight loss or eating healthy, that may not drinking 5 Dr. Peppers a day, things like that. This is my dad I'm talking about. That help heart issues just a little bit. So looking at, solutions with medicine versus solutions with just how do you live daily. I think that is the big takeaway with the drug industry in general, is there is a lot of money made basically managing a chronic condition opposed to working on potentially getting rid of or fixing a lot of the chronic conditions. And we're also seeing things like we just had a huge thing with the opioid epidemic. We've seen a lot of information on the news about that, about monitoring how much opioids people can get and what the max amounts are. And if you need more, you have to go through step therapy. And they made it very, very difficult. I think that was, 2 years ago? But one of the main side effects is constipation. So we deal with a lot of then drugs on top of drugs to manage side effects.
Absolutely.
So that's just one example of like many of the different types of chronic conditions. Like a chronic condition like arthritis, maybe you're taking opioids because it gets that bad, but then you're addicted and then you've got constipation as a side effect. So now you're taking more medication. So the drug industry in general, it's kind of a cyclical thing.
It really, really is. And, as we have seen drugs come out to specifically handle these various chronic conditions, we have similarly seen the insurance industry, lobby and step up to the plate to try to create specifically designed insurance products to manage these very same issues. And you're probably all very familiar, and if you're not, well, you will be soon, with C-SNPs, or chronic special needs plans, a type of Medicare Advantage plan specifically designed to better facilitate care for those with one or more chronic conditions. Interestingly, it has one of the only cases where a Medicare Advantage plan can ask health questions, and it's a little bit of inverse underwriting to make sure that you are sick enough to be on this plan.
The doctor has to testify too. But essentially, when you're looking at C-SNPs, as of right now, even though there are 21 different chronic condition cases per the CDC, only 2 of them have C-SNP plans, which is diabetes and heart conditions. They are actually categorized into 5 different types of groups, but essentially, and this is they meaning CMS, but essentially, if your client has a heart condition or diabetes, there might be a chronic plan in your area, and those plans are specifically designed to help people with that particular condition.
Absolutely. A lot of us are probably relatively familiar with these. Again, some combination of diabetes and heart issues, whether it's heart failure, cardiovascular disorders, stroke and cardiovascular disorders, many different groupings. But I think the biggest takeaway for this is that in an effort to better coordinate care, and if you look at a lot of things going through CMS right now, that's going to continue to be a narrative that they push. You see this C-SNP special enrollment period that does allow beneficiaries to go into a C-SNP plan at any time throughout the year, once per year per condition. So, for example, if someone has diabetes, they can move into a C-SNP plan at any time throughout the year. They cannot use that to move to a different C-SNP later in the year based on that same chronic condition. But they could use some other SEP, such as 5-star plan or something else, if they need to change plans in the future.
I think the cool thing, though, that these plans do is a lot of them get like a caseworker. So let's say you have a diabetes, for example, and you call up the insurance carrier, you'll have a person that will work specifically with you to help manage that and to make sure that you're getting the care you need. In addition to that, as an agent, I think it's important to network with the people who do accept chronic condition plans, and maybe like doctors, pharmacies, things like that. Maybe even educating a couple of the doctors or pharmacists if that is a passion of yours, of making sure that they have these plans available to them. There's just a lot of extra things that these plans do specifically, such as like transportation benefit, things like that, where maybe that person is unable to go to all their doctor appointments because they can't drive for any reason, and now instead of having a family member take off work, they can use a transportation benefit. So taking a look at what is available in your area is super important, because it allows you to open up literally the marketing for, what do we say, 133 million Americans, nearly half the population.
Sure.
And I would say the majority of them have, out of that half, majority of them have, out of the 21 different cases, one of these 2 diabetes or heart condition situation. So definitely a good way to take a look at these plans and make sure that you aren't missing out on a huge niche in your market.
And, among the benefits of getting someone into one of these plans, in addition to that care coordination, sometimes lower specialist copays or specialized formularies, one of the big trends in the past few years, since they recently became allowed for plans to offer, are those special supplemental benefits for the chronically ill that we mentioned previously. And it's some really interesting and novel ways to approach care that tries to address non-health related, lifestyle-based issues that are impacting overall care. And they have gotten very, very creative with the types of benefits that they offer. Even seeing things like pest control, air conditioning. In some of the plans in the Deep South, we actually see air conditioning as a specifically mentioned benefit for those that do qualify for it. Non-medical transportation, just to get out and about in the community. You can get a ride to church every Sunday in some cases on some of these plans if you qualify based on a chronic illness, and just access to social activities, whether it's even things like park memberships or other, access to social activities out in the community. And there's some great resources out there that show kind of what the most common benefits are. Definitely the most common above and by far is some kind of food benefit, whether that's meal delivery or like a healthy food grocery type card. Definitely some of the most common SSBCI benefits that we're seeing currently. And I expect that to continue. There's a huge push in the, kind of general healthcare space and under 65 market with this concept of food as medicine, and, putting the right things into our body to get the right things out of our body. And I think that's something we'll continue to see in the near to mid future.
And I think on top of that, we talked about on a previous episode about caregivers, and how caregivers not only take care of people who usually are just elderly in general, and we already know half of the senior population has one to two chronic conditions, but a lot of them are also dealing with, I think we said 54% of caregivers have at least one chronic condition. So I think just also taking a look at that past episode, thinking through caregivers on top of that, when you're looking at chronic conditions, some of these things like taking them to church or having more coordinated benefits that could potentially help them with that depression and anxiety and all the other stressors that they have, and just in general make their life a little bit more pleasant. So I think not forgetting that that's a huge aspect of these chronic condition cases is a lot of them are caregivers.
Absolutely. And, once we get into some of the specific chronic conditions, I know we talked a little bit about diabetes and heart issues already, but another thing that back in the day we saw a little bit of leverage on, and not so much anymore, but there's always a lot of things going on with end-stage renal disease. And that's another really common chronic condition, unfortunately, one that we see more and more often. And there's obviously a lot of weird stuff that goes on when you talk about end-stage renal disease. So looking at things like Medicare secondary payer, it's one of the most common reasons for people to go on Medicare under the age of 65 is ESRD or some other disability. And looking at that odd 30-month coordination period between the group plan and Medicare and some of the additional services that people may not be able to access on Medicare while they're waiting for Medicare to become primary. And then, of course, some of the only people that can actually lose Medicare. Now, luckily, it's because they've gotten better and are no longer in end-stage renal disease.
Transplant causes you to lose it.
Absolutely. Transplant or stopping dialysis, you can actually lose Medicare coverage, but due to the nature of that lifelong need for immunosuppressive drugs, you actually can qualify for partial Part B just to cover transplant drugs after that kidney transplant, even after that 36-month period. So there is kind of a secondary set of folks that have very specific needs within that chronic conditions category of beneficiaries.
Yeah, absolutely. That's a really good point. And now it's also not a health question on Medicare Advantage plan, so that helps as well. In addition to that, I think just knowing the chronic condition world, talking to doctors about basically how they're writing notes, maybe not talking to doctors, but just knowing that the importance of doctors' notes and prescribing different things, knowing particular medications, what that triggers in your head of like, oh, that person's a chronic condition case or this one's not. And then also being very well versed in pre-authorization and step therapy. I think that's very important as an agent to kind of know what that process looks like, because if a person's like, I literally cannot be on this particular heart medicine, I know it's in the formulary and that's the only one this year that's in the formulary, but it has some sort of like filler drug in there that really causes issues with me and my doctor doesn't want me on it. Okay, cool. If your client tells you that, then walking them through step therapy, getting the doctor to basically sign off on the drug that they actually need. They basically have to prove that that particular drug that's on the formulary is something that they can't take. Mm-hmm. So as an agent, that's a huge benefit and huge resource that you can provide.
Absolutely. And I think, it's all about helping them access that better level of care, getting access to some of those additional services, whether it is those SSBCI benefits or whether it's simple care coordination services. Oftentimes those do need to be qualified for. And if the carrier can't find it through a simple chart review, they may not have access to some of those benefits without input from the physician. So there's a lot of groundwork to do in some cases for those clients. And, as we talk about, again, what your action should be as an agent, I think the biggest thing is, with this being such a huge chunk of the Medicare market, in addition to the population as a whole, it helps you better understand your clients and their needs and how it can complicate their care. And it gives you some real opportunities to create some specialized networks for these various chronic conditions, whether you have a specific passion due to past personal experience, or whether you just find someone that you know, or a group of people that you naturally connect with. It gives you the ability to create a specialized network, pass referrals back and forth, and create a natural flow of business for everyone in that network that you've built.
And I think part of being an agent is it's not just order taking anymore. It's not, you know, here's what you need. You know, they're not looking to you for information anymore. They've already done a lot of pre-work trying to figure out Medicare. So an agent today, if you're going to be successful, it means networking with your community. It means becoming a resource for your community and a resource for your clients. And this is a phenomenal way to become a resource, of just knowing the specific niches that are available to you, like chronic conditions. And then even if you want to go the extra mile, finding what's available in your local community and how you can help that person. So I think that's one of the biggest takeaways that I got out of this, is just making sure that they know about this particular niche, and also how many people it affects, and the different opportunities like the C-SNP plans, and some of the resources that could be available to their clients.
Absolutely. And just to kind of wrap things up, I think if you can develop specialized programming for whether it's seminars, events, caregiver education, you can see our caregiver episode, lots of great information there, but it's a great way to, again, cement yourself as a local expert and improve that kind of client flow and workflow for yourself. And it can actually take a lot of burden off of you, because the better educated your clients and their caregivers can be about managing chronic conditions, the less questions that you will get that can kind of eat up some of your time and things like that. But the biggest thing that I would have an agent take away from this particular episode, and again, thank you all so much for tuning in every time to Medicare Industry Insider, is keep an eye on this and don't assume it doesn't affect you. We already know for a fact that the vast majority, over 2/3 of your clients, have 2 or more chronic conditions. So even if you don't find yourself writing a lot of chronic plans, this is not something that doesn't affect your clients, and you do have the tools at your fingertips to make a huge difference in how you run your business and the care that your clients are able to access. So as always, thanks for watching, and we'll see you on the next one.